for us as representing the community health centers across the state of Utah, and largely referred to as the safety net, is sort of understanding the role of working poor households, those who are uninsured as well as insured, and making sure that we're bringing along everybody through this process. Right now we're working towards a shift in our system that's largely focused on volume into value, and it's easy to say but hard to do, particularly with the payer mixes that we have with large volumes of uninsured. We're not receiving payments for those. How do we shift from a value-based, or to a value-based system from what's largely been volume, even on that end? Two big things for us right now is we represent 14 independent community health centers, from community migrant and homeless health centers. So recognizing their independence but trying to work with them as a whole and leveraging that. So we've implemented in the last year a population health management software solution that's looking at data warehousing, reporting, and actually point of care tools for the care teams to be able to extract disparate data on their patients and put it into a useful format. So we're now being able to reach more proactively than we have before by the use of this electronic tool that's attached to and connected and mapped to each of their individual EMRs. If we can have data at the point of care, care teams can start to address gaps at the time we have the patient in the health center, and we can be proactive that way. But for us, it's a financial equation when we're calling a patient who may be uninsured. That's money that they're looking at out of their pocket, and these are typically working poor households. So it becomes really problematic and difficult to bring patients back in for preventive visits when they're looking at the cost, right? I might need that money for rent or for food. I'm going to skip that visit to deal with my diabetes because I feel okay right now. So we're really trying to be able to get them when we get them, and then start that approach to move upstream as well.